For a successful volume navigation study, it's important to understand all the components and how to properly set it up prior to your patient coming into the room. I'm going to walk you through all the pieces, how everything will interact, and how we set this up for our procedure. First off, this is an electromagnetic transmitter that sits on a stand right alongside our patient. This sends out an electromagnetic field from this point in the transmitter, about 18 inches. So this will sit right next to our patient. There's going to be brackets, and there's a variety of brackets available for all of our different ultrasound transducers. On the side of the bracket, it's labeled for which transducer it's going to work for. You want to make sure you choose the bracket that's appropriate for the transducer that you'll be using for the procedure. There's going to be a sensor that snaps onto the side of these brackets. One side, as you can see, has a pink ribbon, corresponds with a pink ribbon that's on the side of the connector, and this will plug into both the bracket and the ultrasound system. And there's small clips here that we're going to use to attach this to our ultrasound transducer. First off, I'm going to pick up my C1 to 5 transducer and my corresponding bracket. To put this together, there's going to be one side of the transducer has a circle, which corresponds to a circle on the side of the bracket. I'm just going to place that into it and snap it right in place. Next, I'm going to take my sensors, and again, one side has a pink ribbon on it, one side does not. I typically plug in the one with the pink ribbon into the number 1 position, and then the other one into the number 2 position. This will now attach just using these clips. And I'll just use a couple of them here. Once these are attached, now I'm just going to plug this into the ultrasound system. Again, there's 2 plugs to correspond with the 2 sensors. The one that has the pink ribbon is in the number 1 spot, so this will correspond to the number 1 plug on the system. So I'm just going to plug this in right here. And then I'm going to plug the other one in the number 2 spot. Now we would be prepared to begin our diagnostic ultrasound procedure utilizing volume navigation. There may be an opportunity that we want to use this technology to help us for an interventional procedure. In that case, we may want to use an additional guide. The UltraPro E guide, which I'm going to open up here now, is a guide that will snap onto the side of the transducer that helps me stay within the ultrasound beam, but still gives me full flexibility to come at it from any angle. If we were doing this as an interventional procedure, we would have to use proper sterile technique in setting this up, but I'm just going to walk you through an example of how this would work. We have the probe drape. I'm just going to put some ultrasound gel inside the drape. This transducer would fit right inside. This would come down. We'd have the rubber band that secures it all together. And on the outside now, the UltraPro E guide would just snap right on. And again, this is going to help me stay within the ultrasound beam, so I can combine volume navigation along with an interventional procedure to help me do my study. One final comment for this: as I look at the environment that all of this is set up in, I just need to be aware how everything is going to interact. On the ultrasound system, there are several small indicators on the monitor in the upper left-hand corner, the green bars. This lets me know that everything is set up in an environment that's conducive for doing this procedure utilizing volume navigation. I've now demonstrated to you how to properly set up for a volume navigation study for both a diagnostic exam or an interventional procedure.